Kidney, big picture. Nervous system controls the second-to-second responses of the cardiovascular system, all right? The kidney is responsible for the hours to days components of the cardiovascular system. And the reason for that is twofold. Number one, the kidney is the only place in the body that we can effectively get rid of fluid rapidly, right? And because plasma volume plays such a huge role in blood pressure in the cardiovascular system, the kidney is in charge of plasma volume. Therefore, it's in charge of blood pressure. Now, the other reason, probably the more specific reason, is the kidney needs blood pressure to function. Without blood pressure, you cannot make urine because it's a pressure filter. So it makes sense that the kidney, which depends on blood pressure for function, would also be the long-term controller of blood pressure in the body, right? The heart doesn't need blood pressure, it just makes blood pressure. The kidney needs blood pressure. So it makes sense that it would be the manager. All right, so objectives, okay. So big picture, sympathetic moment to moment, doing so by causing vasoconstriction, venoconstriction, and changes in the heart, right? That's sympathetic nervous system. That's nervous system control of cardiovascular. Ultimately, it's plasma volume that's going to play a huge role in blood pressure, and I have some graphs to show you to prove that. The kidney is that site of homeostatic fluid balance, so it's the spot. Okay, so first thing we have to think about is the fact that pressure and urine output are directly related. Okay, the kidney is a pressure filter. In other words, pressure pushes fluid in and filtrate comes out. So the more pressure we have, the more filtration we get. Okay, so in my graph here, this is arterial pressure. This is urinary output. Now, I wish this had one more label that said acutely, right? Because this is an acute change. If you looked at this over weeks or months, it would be a different chart, as we'll see at the end. Okay. So what this says is the greater the pressure, excuse me, the greater the pressure, the greater the urine output, right? So as blood pressure goes up, your urine output goes up. Makes perfect sense because the kidney excretes fluids by blood pressure. So if we have more force pushing fluid through the filter, we get more filtration. We call this pressure diuresis. That the higher the blood pressure is, the more urine output you're going to make. Now, also important to know that salt will follow the water. Okay, I made that little change, so make that change in your slide. Both are accurate. Water follows salt is the way we usually put it, but salt also follows water. If we move salt, water will follow along. And just as a sidebar, that's pretty much how we move water around in our body, right? We don't have water transporters. So there's nowhere in the cellular mechanics is there a water pump, right? But we do have sodium pumps. So the way the body moves water around is it moves the salt and then the water follows, right? Or it moves the water and then the salt follows. So salt will follow the water. So as we increase our urine output, we will increase our salt excretion. Now, you have to do a little thinking about this. The more urine output you make, how does increasing urine output affect plasma volume? It's going to decrease it, right? And plasma volume plays a big role in blood pressure. So the more you pee out, the less your pressure will be, too. You see? So like in this example, whatever is making the pressure increase must not have a lot to do with plasma volume, right? Because we just see this increasing urine output.